So we're going to go back 1,500 years BC to the first steps of hair restoration. As we all know, hair loss due to disease, scarring, and in particular androgenetic alopecia seems to have troubled the members of the human race since the dawn of time. Let's travel 1,500 years BC to the modern day of the FUE hair transplantation. In ancient Egypt, back in 1500 BC, a papyrus, Eber's papyrus, was a medical papyrus of herbal knowledge, and it includes a prescription for restoring hair. It even mentions alopecia areata. It is a 110-page scroll at 20 meters long, among the oldest preserved medical documents. For hair loss, the prescription was a mixture of herbs and animal fat, probably without any results. And then we travel to the Hippocrates era in ancient Greece. Personally affected by male pattern baldness, the ancient Greek physician Hippocrates, who was born around 460 BC, tried several formulations on his own scalp. He experimented with numerous treatments like a topical concoction of opium, pigeon droppings, horseradish, beetroot, and other spices, but didn't stop his hairline from receding. The father of Western medicine earned the distinction of being the first to document a step-by-step course of male pattern baldness, which was given the Greek name alopecia. And let's make the journey from the Hippocrates era to modern day. We go back in Rome in 44 BC. Hair was a symbol of power and virility. Emperor Julius Caesar fought his receding hairline cosmetically, first with the combing back to front his hair, and then by wearing a laurel wreath upon his head. Coincidentally, this laurel wreath became a symbol of power and virility in ancient Rome. 1,000 years after Christ, we find the Celtic hair loss remedy required patients to stuff mice into clay jars, put the jar beside a fire, remove it after 1 year, and apply it on the head. And in 1624 AC, we have King Louis of France made wigs popular again by wearing a full headpiece to cover his thinning hair. Not long after, members of his court followed suit, regardless of their level of hair loss. Large powdered wigs soon became the height of fashion and wealth and spread to England a short time after. In the 1700s, the wig trend crossed the Atlantic with American colonists. Most wealthy people wore wigs to acknowledge their socioeconomic class. After the American and French revolutions, however, people didn't want to be associated with royalty and class, so the wig trend faded. In the 1800s, we have ridiculous, unscientific, and untested cures, unfortunately. Many were outright scams designed to take advantage of hopeful buyers seeking a medicinal solution. In 1922, popular health advocate Bernard McFadden criticizes medical professionals and drug lotion manufacturers for their rampant unscientific behavior and dishonesty. Ironically, he then blames hair loss on poor hygiene and lack of physical activity. He recommended scalp massages and vigorous brushing. In the 1920s, we have the thermocap device. It was created by the Allied Merck Institute. So men and women with hair loss simply had to spend 15 minutes a day under the bonnet-like gadget's heat and blue light, which supposedly stimulated dormant hair follicles. A 1923 Popular Mechanics advertorial asked, "Has a remedy for baldness been discovered yet?" Unfortunately, the answer was no. In the 1930s, we have the birth of modern transplant techniques. Japanese dermatologists Sasakawa, Okuda, Tamura, and Fujita were using small autografts containing hair follicles for the correction of scars and cicatricial alopecias. This is the beginning of punch grafting, a strip technique. Their pioneer work unfortunately remained unknown to the rest of the world for many, many years due to World War II. Then we travel to the 50s when we have the punch graft technique. Modern cosmetic hair transplant surgery dates from the work of New York dermatologist Norman Orentreich. By 1970, the technique known as punch grafting was being performed by small numbers of dedicated practitioners around the world. Orentrijk's 4mm punch graft method remained the basic procedure until 1975. Popularity of punch grafts meant that a generation of patients went around with a natural dull look. In the 1970s, we have the scalp reduction technique, performed in the hospital or at the doctor's office under local anesthesia. So the bald part of the scalp at the top of the crown of the head is surgically removed, suturing the edges of the nearby hair-bearing skin, thus bringing the hair-bearing scalp from either side to meet in the middle. Frequent formation of hypertrophic scars, unnatural appearance due to altered direction of hair growth was the issue. And then in the 1970s and 80s, we have a more drastic surgical technique, the scalp lift technique. It was a radical form of scalp reduction, a major surgery at hospital under general anesthesia. Frequent complications were numbness of the scalp, scarring, and additional hair loss. In the 1980s, we had the scalp flaps technique, a surgical procedure performed in hospitals. So a flap of hair-bearing skin is removed from the side of the scalp to the front hairline, thus reducing bald area. The technique leaves a bad scar, a poor result of hair growing in the opposite direction. Moving to a very popular technique, the FUE technique, or as it's known, the strip technique, was the follicular unit transplantation. It's a quite long and intensive surgical procedure under local anesthesia or even sedation, where a 20-25 centimeters long and 1 to 2.5 centimeters tall strip of skin is removed from the donor area, cutting skin, muscles, nerves, and blood vessels, and stitches are placed. Hair follicles are divided under the microscope, thus prolonging the time before implantation, increasing the damage factor, and adding human error. Slits or reception holes with a needle are made prior to the implantation. The growth rates vary, and the results were usually unnatural with the obvious transplanted image. And now we move to the modern era, the modern technique, the follicular unit extraction. Follicular unit extraction was first described in 1988 by Masumi Inaba in Japan, who introduced the use of 1mm needle for extracting follicular units. It took its place in the medical literature in 2002 thanks to William Rassman and Robert Bernstein. They used 1mm punch to harvest individual follicular units. The first part of the procedure involves making an incision with a circular cutting punch around the hair follicle through the epidermis into the subcutaneous tissue in order to release the follicle from the underlying tissue. The follicular unit is a full-thickness skin graft containing epidermis, dermis, and fat. The graft is then subsequently extracted using suction or forceps and carefully preserved until it is time to implant it into the donor scalp or recipient area. Minimum donor site injury and more natural results in comparison with previous techniques. New tools were used, a manual punch for extracting each follicle separately from donor area, and a special implanter tool for a more accurate implantation depth and angle-wise. Hair follicles are divided after extraction under the microscope. Reception holes are made prior to the implantation. Since 2002, FUE became the most popular technique of hair transplantation, and it has been evolving ever since. The manual punch extractor tool has been replaced by a motorized drill machine. Robotic FUE was developed in recent years. It is a surgical hair restoration procedure in which a three-dimensional optical system used to locate and harvest follicular units directly from the donor area. Restoration Robotics, Inc. introduced the robotic hair transplantation to the field of hair restoration in 2011 when it launched the first ARTAS robot. A few words about our medical group, the Seneca Medical Group, and our experience. So we used the FUE technique, an advanced technique, the direct hair implantation. 100% of the procedure from start to finish is performed by trained and certified medical doctors following a strict medical protocol. The last 5 years, we have replaced the manual punch with a motorized one. The advantages are significant. Smaller punches, more accurate, less transection, faster extraction, faster healing, easier extraction on even difficult cases. The follicles are extracted using small punches less than 1 millimeter in diameter with no prior handling under the microscope, direct technique. They are preserved in a special biopreservation liquid in low temperature, and no reception holes are made prior to the implantation. Each follicle is inserted directly with the implanter. Direction and depth are totally controlled, thus providing high survival rate and 100% natural and safe result. Unshaved procedures are done as well with this technique. The growth rate is more than 90% as per Seneca studies. Thank you very much. Thank you.